Welcome back to another episode of Christian Natural Health. Today, I'm very pleased to have Dr. Kate Davis with us. Dr. Kate is a chiropractor and a functional medicine doctor who personally battled chronic gut issues for nearly a decade, only to find out that she had a massive parasite infection. Leveraging her gut healing journey, she has since helped hundreds of women to overcome chronic gut conditions from constipation to bloating to IBS and acid reflux. Welcome, Dr. Kate. Thanks so much for joining us.
Yeah, thank you so much for having me, Dr. Lauren. I'm really excited to be here.
Yeah, good. So tell us a little bit about your story first. So I assume, was this after you were already a provider yourself that you were dealing with this, or did that lead you into this path? How did that work?
Yeah, well, that's a great question. And yeah, again, I just want to thank you for having me on here. I'm really excited to talk about this because it's such an important topic. I feel like in especially in today's day and age. But
Totally.
I got into functional medicine because of my own journey with
Yeah.
really chronic constipation and bloating issues. I went 13 days without having a single bowel movement when this all first started. And I was 24 years old.
Yeah.
Very, 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 like it just didn't make sense. And so, and
Yeah.
nothing the medical doctors offered me helped. And so, I was given two really terrible options of take this drug for the rest of your life that has a permanent side effect of facial twitches, or we can remove your intestines. And that was all they told me. And so,
What?
yeah,
My
I know.
gosh, that's nuts.
It
Wow.
is. Yeah, I was shocked too. I was like, there's no way I'm letting you remove an organ that like why was that the first place that they would go? But anyways,
Yeah, yeah,
that's
totally.
Western medicine for you in America,
Right.
unfortunately.
Oh, very
But
sad.
I was really, oh, sorry, go ahead.
No, I thought, go ahead.
Oh,
Mhm.
okay. But yeah, I was really fortunate. It was just such a huge blessing that I was introduced to this chiropractor who did a bunch of myofascial release in my abdomen.
Mhm.
And I swear, Dr. Lauren, I lost like 10 pounds that night. Like it was such a relief, for the first
Wow.
time in almost 2 weeks, I was able to actually have a bowel movement. And,
Yeah.
it was, and so that's why I'm so passionate about gut health. I love helping people with this because I
Yeah.
remember being in that place. I remember being really scared, not knowing what to do, and just thinking to myself, I'm young, I'm healthy, I was a former D1 athlete, I take care of myself. Why am I so sick and everyone around me is so healthy? I was 24 at the time.
Yeah.
It just didn't make sense. And
Mhm.
so,
Yeah.
I thought to myself, there has to be a better way. There's no way these are the only options. And so, luckily I was already in chiropractic school at the time and somebody referred me to that doctor and he just completely changed my life.
Yeah.
And after that, I completely overhauled my diet. I went on a really extreme, paleo,
Sure.
dairy-free, gluten-free diet.
Yeah.
And as long as I stayed on that restrictive diet, I was pretty good, 90% better.
Yeah.
But anytime I strayed off of it, all my symptoms would come back. And, I was okay with that. I was like, well, it could be worse, right? But
Sure.
then, 8, 9 years down the road, so almost a decade later, I had a really stressful life event happen and all my symptoms came back and they were worse than they were when I was 24. I was on the verge of an autoimmune disease. I was getting like swelling in random joints that didn't make any sense. And luckily, my friend was in town as a functional medicine doctor. And she just looks at me after I'm telling her all this stuff that's going on. She's like, Kate, you either have Lyme disease or parasites or both because this does not make sense. You should not be this sick. Like I know you. I know you take care of yourself. You eat well, you exercise,
Yeah.
you take care of your mental health. Like there's no reason you should be feeling this sick. And, after she did some testing, we figured out,
Mhm.
in addition to a bunch of other issues, but I had a very, very big parasite infection. And
Mhm.
it wasn't until I passed, she put me on this really specific, unique individualized care plan, which I definitely want to emphasize because I'm sure you
Nice.
have this with your
Yep.
patients as
Yep.
well. But, it was uniquely tailored to me. It wasn't just a random one I bought on the internet, but she put me on this unique plan. And once I passed a 3 foot long parasite, it was gigantic. And after that, all of my symptoms started going away. And within 4 months, I felt like a new person. And
Oh,
so I just
wow.
started, treating all my chiropractic patients. Obviously, I was being trained by my friend who's a functional med doctor.
Yeah.
And I was just seeing these phenomenal results with people. And so I just, that's kind of how I got into the functional medicine world. I just had such a
Yeah.
transformation. And,
Good.
since then, I've been able to help hundreds of women,
Uh-huh.
heal constipation and bloating and acid reflux and gas and, all those things that just are really terrible to deal with. If anyone has never had gut issues, that's a huge blessing. So count yourself lucky. But
Yeah,
it's
totally.
awful to deal with. It really affects, your whole life. So
Right.
that's how I got into
Yeah.
this.
Yeah, awesome. So, and you kind of alluded to the generic advice on social media. So, I'm not really on social media particularly, but my patients are coming in all the time lately and saying, "I just saw this thing, usually on Instagram, of there's this, and a lot of times it's parasite cleanses. Sometimes it's cleanses in general, but
Mhm.
lately it seems like parasite is the big thing, and everybody's wanting to go there. What is your perspective on this trend?"
Yeah, it's a great question because it's also the number one question I get. Because every time I share my
Mhm.
story,
Sure.
obviously a big part of it was, I had a massive
These
parasite infection.
parasites. Yeah,
The
exactly.
three, the 3 footer wasn't the only one that came out. I had hundreds, all different shapes and sizes. Like I was infested. And so when I share my story, people are just like, "What parasite cleanse did you use?" And I'm like, "No, no.
Yeah,
There's a way that you have to heal. I would not, I think the worst generic advice I see on Instagram is a lot of people are just promoting one product. Hey,
mm,
everyone needs a parasite cleanse. Buy this product, type
right.
my code,
Mhm.
use my name for 20% off on
Sure. Yeah, yeah, totally.
this spray or this gut cleanse. It's going to be like 2 to 3 weeks long, and then you're going to be completely
Right.
healed and all your health issues are going to go away. And I think that that's always a red flag. If someone's trying to just sell everyone on one product, that's a huge red flag for me. And I think any
Absolutely.
doctor, yeah,
Yeah.
any doctor who like you, is in naturopathic medicine, or if you're in functional medicine or anything alternative, we understand like the individualized care model is so much more important than the westernized view of one problem, one solution, which
Here's
is
the
where
silver
everyone's been
bullet.
stuck. Yeah.
Exactly. Exactly.
Yeah, everyone's been so stuck in that mindset for so many years that they just assume, oh, well, everyone has parasites. It's probably good for everyone to do a cleanse. And,
Mhm.
I agree with that to a certain extent, but
Mhm.
I don't think you should ever blindly jump on something because a lot of people just assume, oh, it's just a detox, it's herbs. There's no way it can mess me up. It can
Sure.
absolutely mess you up if you don't know what you're doing. Like herbs are powerful. That's what
They
drugs are
are.
derived from, is
Yeah,
herb. They just make it,
exactly.
100 to 1,000 times more powerful. And
Sure.
that's what makes a prescription drug. And so you can really mess yourself up. So what I always tell people is if you want to do this type of cleanse, because it is a big trendy thing now because everyone's posting pictures of the parasites and I post those on Instagram too. And
Sure.
people are
Yeah.
shocked and
Yeah.
always asking me, well, how do I do this? And
Hmm.
the answer is always you have to get a good view of your whole body. You've got to get some testing done because what people don't realize, the biggest thing people miss, and this is when I get people messaging me saying, "Hey, I tried a parasite cleanse, ended up in the ER," or "I got really sick," or "Now I have gut issues that I didn't have before," because
Yeah.
they don't understand that you have to open up drainage pathways in your body, the
Mhm.
biggest one being your gut. So if you're constipated, if you have leaky gut, if you have IBS, you
Right.
already have a toxic environment. That's the number one way toxins get released from your body. If it's not working properly, your body's going to use other organs to detox for you, like your
Sure.
skin, your respiratory system,
Yep.
your kidneys. And so then people get, kidney issues or they get flu-like symptoms and they just get, like a chest cold or, that's probably just a
Mhm.
detox reaction.
Sure.
And so it's really important to heal,
Yeah.
really figure out what's damaging the gut, heal it at, a foundational level, and
Mhm.
then go after gallbladder and liver and make sure those are functioning well. Because when you kill off parasites in the body, they release a ton of toxins when your immune system kills them off. And people don't realize this. They're called,
Mhm.
if you get like a Herxing reaction, they're called die-off symptoms if people just jump on a parasite cleanse and don't know what they're doing.
Yeah.
Or maybe you don't have any gut symptoms, but you do have inflammation in the gut lining, so it still affects you. Because a lot
Mhm.
of people say, oh, well, I'm going to the bathroom
Right.
once a day, and I'm like, okay, well, do you have food sensitivities? They're like, oh yeah, I can't eat bread. I get extremely bloated every time I eat it. And I'm like, okay, well, you have gut issues. Like that's a
Yeah.
problem.
Right.
You
Exactly.
should be able to eat food without feeling terrible after.
Sure.
And so that's the thing I really emphasize for people is
Mhm.
get some testing done. It's going to save you so much pain down the road. And
Mhm.
yes, there are some people who just hit the jackpot and the first thing they buy on Instagram fixes all their issues and they're like, this is the cure. And
Right.
it's like, great. I'm glad you were the one person who found the exact
Yeah.
solution the first time you tried, but most people
Sure.
aren't that lucky. And I see
Right.
those people all the time,
Mhm.
coming to me being like, can you fix me? Because I really messed myself up trying to heal myself on my own.
Mhm.
And so
Yeah.
that's why, it's so important to get, specialized like functional medicine testing done to really see, do you have leaky gut? Because if you just start releasing a bunch of toxins into your
Yeah.
system and
Right.
you have, breakdown of that gut barrier, it's just going to recirculate through your bloodstream and go through your liver again. And now your liver is going to get really inflamed and overworked. And
Mhm.
then you probably see this in your practice of, people getting hormone issues and all the stuff that kind of goes along with, liver stress. And
Totally.
so it's just this whole idea of just understanding that number one, you shouldn't just jump on a cleanse blindly. That's just dangerous. Like
Mhm.
you could really mess yourself up. But number two, there's also, you also have to consider other co-infections in the body
Right.
that are, you could get rid of parasites and they'll just come right back if you don't ever fix the root
Mhm.
cause of what's dampening the immune system and preventing it from naturally removing the stuff from your body.
Mhm.
Because you should be able to go eat sushi if there's any, parasite larva in it, break it down, get it out of your system in a reasonable
Right.
amount of time. But it's when you have that breakdown of the immune system,
Mhm.
that's when this stuff starts building and building and building in your system and eventually creates all those health issues that we see with parasites. So it's also important to know, okay, is there mold toxicity? Is there, SIBO or an overgrowth of bacteria in the gut that's
Mhm.
preventing, that's creating a lot of inflammation and preventing good, absorption of nutrients
Mhm.
and is there, are there toxins like heavy metals or, chemicals and, phthalates and, pesticide residue in your system that's just
Sure.
causing massive inflammation and
Right.
preventing that gut from fully healing and the liver from
Right.
healing and,
Yeah.
all those organs that really help break down and remove waste products from your body. So those are probably the two biggest things I tell people is like, hey, you've got to get a full picture. If you're just looking at parasites, there could be all
Yeah.
this other stuff going on
Right.
around the parasites that are
Yeah.
allowing them to overgrow. Like for me, yes, that was my biggest issue, but I also had fungal overgrowth, candida in the gut. I also had leaky gut. I had a really sluggish gallbladder. It
Mhm.
was not functioning well. And
Yeah.
so I had to heal all that stuff before I
Right.
even went after the parasites.
Right.
And so that's a really important thing to understand is there's so many different factors to consider. It's not just find an infection, go after it with detoxing. It's like, no, no,
Mhm.
no, we need to look at the whole picture
Right.
so we can
Yeah.
be really laser focused and get you better faster and do it in a way that's safe and that's not gonna, mess you up.
Create a
Or
bunch of
break you.
problems.
Yeah.
Yeah. Yeah, absolutely. So I like how you're talking about the therapeutic order, the fact that first of all, you're going to look at in general, depending on somebody's story, what was going on within their lives, if their environment, external environment is toxic, you got to get out of that, of course. And
Yeah.
then you have to make sure that you're in an environment that's conducive to health. And some of that is also going to be, okay, let's make sure that we're at the place where you're able to physically detox internally. And you're talking about the emunctories, like you're starting with the colon so that you're able to remove, and then you're kind of working your way up like squeezing a tube of toothpaste so that
Yeah.
all these toxins can actually get all the way out. That's great. And yeah, absolutely. I think that because of the way that we've all been sort of taught indirectly by our experience with medicine, we do have this silver bullet concept of
Mhm.
like, if there's one infection, then there's it, whatever it might be, whatever the disease might be, there's one pill that can fix it. And unfortunately, for most chronic illness, that's not generally the case. So, in your case, do you know where the parasites came from?
Honestly, I don't because
Oh,
by that point, I had already traveled to multiple different countries,
oh, okay. So you
Yeah,
know
I
it came
mean,
from a lot of overseas
I
exposure potentially.
mean, honestly, like I know that's like the common, like even when I was in undergrad, I was a microbiome major, so I had a parasitology class, like all about parasites, which was my favorite class, which is ironic
So
that I
ironic.
this is
Right.
like, this is like 4 years before all my
Sure.
started, and I was like, wow, this is really fascinating. I love learning about parasites, and I was like, oh
Yeah.
yeah, 'cause I was infested with them. That makes a lot of sense.
Yeah,
But
totally. It's
yeah,
like all
isn't
these
that
little Easter eggs as you look back
Yeah,
in
I
your
know
life.
it's so
For sure.
crazy.
Yeah.
Yeah, God is just funny that way, where he's like highlighting, hey, you should look
Yeah,
into
you should really pay attention to this. It's gonna matter later.
Yeah, and so what they teach you is that, oh, you don't have to worry about it. These parasites only, live in third world countries. We don't really have them in America.
Yeah.
That is so far from the truth. I mean, granted, I do work with gut issues, so I probably see them a lot more than people who are, working on insulin issues or hormone
Yeah.
issues. But probably about 75% of my patients have parasites that I see.
Yeah.
Like
So
it's a lot more common than people think.
So this brings up an interesting question. So I've struggled to actually come up with a test that I trust to find actual worms. So most of my functional stool culture tests, they say they'll look for worms, like the GI map and the doctor's data and all the rest of them, Genova.
Hmm.
Never seen one catch one in
Hmm.
14 years of practice ever. So then I finally found parasitetesting.com out of Phoenix. It's the only one I trust to find actual worms, but even then they'll only find the larvae. They won't find the actual one. So then I
Yep.
used to have people would bring me the pictures too. And sometimes they would bring me the worms in like little baggies.
Oh,
And
geez.
it was great. Yeah.
So
So
fun.
I would then have people get test tubes and we'd stick them in there and send them to LabCorp because LabCorp says they do this test. But literally every single time I ask them to do this test, they come back and they say it's mucus every time. So I've stopped bothering. So because they're not going to find it. So I'm always perplexed. Like, yeah, if somebody sees worms come out, I believe you. Like that's it's not like there's any questions there. I'm
Mhm.
just wondering, how do we know? How do you actually determine which one are you dealing with? Now, if it's a microscopic, they'll all find it. If it's an amoeba or a protozoa or whatever, all of the functional tests are great at identifying those. But how do you actually diagnose what worm you are dealing with other than visually? Sometimes you can look at it and say, yep, that's this. And then you know what pharmaceutical to use or what herbal combo or whatnot. But what's your experience with this?
Yeah, that's a really great question because I have so many people who come to me and they're like, "Well, I don't think I have parasites because I've done, multiple stool tests and they were all negative." And that is so common. You guys, if you're relying on a stool test to tell you if you have parasites, it's going to miss it most of the time. There's so many false negatives, which just means they tell you you don't have parasites, but you actually do. And so it's really just this combination of someone's health history and their symptoms combined with lab results. And then even if I don't see parasites pop up on testing, I'm like, we're gonna see when we go after the gut and we start cleaning that out with some, like herbs that really remove gut parasites. I
Mhm.
really like Mimosa pudica seed. I think that one works really great for seeing like ropeworms and all those big, big worms that are in the intestines kind of come out of your system. But it's it's so hard to detect. That's why you see all these stories of, incidental findings of parasites where it's like, oh, we thought you had a tumor, but it was just a giant worm in your brain or in your liver. And you're like, great, it ate like part of your organ, but at least you don't have cancer. And
Yeah,
it's
it's
the
something.
story for like they never find the worms because they're so good at hiding from your immune system. And
Mhm.
they're not just found in your gut. They can be anywhere in your body.
Mhm.
And like I had a lot of those little ones, the strongyloides. I had like hundreds of those come out, the ones that embed in your lung tissue and I guess muscle and joints as well, because I was having a lot of
Yeah.
crazy joint muscle pain that went away after I started passing all those parasites. And I was like, huh, wonder
Mhm.
if they were stored in there for a while.
Yeah.
So
So how did they come out if they didn't come out through your gut?
they honestly started coming. Well, no, they did. Like it was
Oh,
in my
okay.
back movements. You
Oh,
can see
okay.
they look like little sesame seeds when they come out.
Okay.
And it's been larva too. It's like we'll never really know 100%. Like,
Like, you're not
even if you
testing
send
them,
it
you're
to
just
the lab. Yeah,
visually
like you said,
saying,
they're like, oh, it's mucus. It's like,
right.
well,
Yeah.
the three
Stick
footer
together really well. Yeah.
I passed was not mucus. And so I was like, I would told my friend, I was like, I'm gonna find one of these 5 footers. I'm gonna be like the biggest worm you've ever found. So I was like CSI, had gloves on, the long Q-tips, trying to find like these
What?
ones. Found the 3 footer. I know. Because I was like, I need to see why I'm so sick. Like, I just need to see it.
Oh,
And so that's how I
yeah.
found the 3 footer.
Right.
And it was definitely a worm because I inspected it to make sure it was not. And it was thick. Like it looked like a little snake living in my body. I was like, what in God's name is this? And it was crazy. But back to your question, because I know we're
Yeah.
just gonna get all
Right.
up into the, parasite
Like
story.
sorting through poop.
I know. And most people don't. Like a lot of my patients are like, I don't want to see that. I'll probably throw up if I do. I'm like, great, just flush the toilet without looking. You'll be fine.
Sure. Yeah,
And then
right.
other ones send me all these pictures that I post on Instagram, so you can go look at them and just see, like,
Oh my goodness.
definitely, it's pretty solid. That's not a
Sure. Yeah, it's
major
got a nervous system and everything.
pro.
Right, whatever.
And just like so the number one thing I would say is like symptoms, right? So people who have parasites, really common symptoms they're going to have, especially if you were a kid and you had teeth grinding, you wet the bed until you were like 10 years old, which is not normal. Usually it's like in the younger years. If you were a really picky eater as a child, those are big signs in kids. Also, any gut issues, like if you have, loose stool or constipation or bloating, if you're dairy sensitive, if you could drink milk and eat cheese as a kid, so it's not a true allergy, but then as an adult, all of a sudden you can't handle dairy, that's a huge sign of parasites as well. I see a lot of dairy sensitivity. And then once we remove them, all of a sudden people are like, oh, I can eat cheese again and, drink milk. And they have zero issues. And that was my story too. I couldn't do gluten or dairy for almost a decade. And now I can eat it every day and I have zero issues with it.
Mhm.
And it's because I got to that root cause and really healed up the leaky gut to
Mhm.
prevent that immune response and then got rid of, the infections that were causing it. But I'd say those are some big symptoms. But honestly, parasites, they're so hard to find because they can cause so many different symptoms. We don't really know the full extent of it. But something interesting too is mental health.
Mhm.
There's actually a study done in, I believe it was Africa, where they found that people infected with parasites had 400% more likelihood towards mental health issues like bipolar and schizophrenia, anxiety, depression. And I've seen that where people's anxiety just goes away once you remove parasites. And obviously it's a more, there's obviously a lot of factors that go into mental health, but that's just a big one that I've seen with
See,
parasites.
and that brings up another question because in a study like that, if we're talking like, peer-reviewed, double-blind, placebo-controlled, whatever, they have to have some objective way to say these people have parasites in order to make that correlation. How did they do that? Like, I'm just, yeah,
Yeah, it's a great question. I'll have to email you the study so you can.
yeah, I would love to investigate that because that is fascinating.
They must have just seen it in their stool. Like that has to be it. Where they're like, oh wow, look at all this stuff coming
That
out.
must have been what it was. Yeah, I would assume so, but that would have to be retrospective. Maybe it was a retrospective analysis or something, because how else could you do that?
That's a great question. Because
Oh.
well, if you think about in America, they're not going to do studies like that because every doctor is told parasites don't exist here. But I've
Mhm.
seen so many people who have never even left the States and they have parasite
And
infections
it
and they
can
see all the
still,
worms come out
sure.
and they're like, what the heck? I've never even been outside the US.
Right.
And,
Yeah.
they do live here. They don't just like,
Right. Yeah.
crawl up to the Mexico US
And
border
they're
and be
like,
like,
oh,
oh, people
okay,
in. The
sure.
border walls are up. We got to go back.
Yeah.
It's like,
Yeah.
they're
Right.
not a respecter of countries.
That's,
They're in everything, like
yeah.
water,
Right.
especially, I'm in San Diego. A lot of people go to Mexico on the weekends and like they don't
Mhm.
know you shouldn't
Sure.
drink the water and the food's a little iffy sometimes and you're probably going
Right.
to pick up parasites. You should probably make sure you have a good solid immune system, which is why
Exactly.
in Mexico it's a standard of growing up there that they do parasite cleanses every 1 to 2 years. It's
Mm-hmm.
very common. And
Mm-hmm.
so if you grow up like that, then yeah, you could totally jump on a parasite cleanse and be totally fine. But if you've never
Done it
focus on
before.
healing your body at all, and then you just jump on a cleanse, you're probably going to get really sick.
Right. And the
And
same thing is
so, yeah.
true if you're trying to treat any other type of infection, not just parasites. But
Yeah.
there's some people where, they've got a massive viral infection or bacterial infection, Lyme, whatever, and they can start an herbal treatment for those things and be fine. But a lot of people are going to have a Herx reaction if you don't do things in the appropriate order so that
Yeah,
you handle all of the die-off.
absolutely.
So
Uh,
for some of my listeners that were possibly a little overwhelmed by your list of like, oh, heavy metals and solvents and all these other things, what would you say to those people of when is it appropriate for you to do all of this additional specialty testing for a given individual, and when would you say that maybe you don't need to focus on one particular area? Is there kind of a protocol that you use that will help you determine that?
yeah, I mean, so I kind of want to jump back on your question of how do you find parasites? Because the
Sure, please.
test, because I had done, because this will answer that question
Right.
for you.
Okay. Yeah.
The test, so I had done multiple stool tests,
Mhm.
when I was 24 and I had all the gut
Of
issues, and
course.
they all came back negative.
Right.
And that chiropractor who fixed me was like, you need to go see a naturopath because I'm pretty sure you have parasites. And I was like, no, 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 I didn't show up on the stool test. I'm good. And I
Mm,
wish I'd listened to him because it would have saved me a lot of years of struggle.
sure.
But
Yeah, right.
anyways, when my friend actually came in town and she did this testing, she actually used a hair test. It's like a hair follicle test. It's not an HTMA, it's a lot different, but it picks up on, infections, toxins. It's the best test I've ever found for parasite infections because I've
Really?
seen so
Okay.
many people who have done like 10 stool tests, they're all negative, and
Right.
then we do a
Yeah.
hair scan, parasites pop up, and they immediately start seeing them once we start healing the gut. They see
Uh-huh.
them start coming out and they're like, oh my God, I did not believe that test was legitimate until I started seeing all this come out. And
Sure.
I'm
Yeah.
the same way, and it shows, what's affecting your gut, what's affecting your immune system, nutrient deficiencies. So for me, I really like that test because it not only is the best one I found for parasites, but it also picks up on a full picture of how your body's doing. It'll show gallbladder dysfunction, liver dysfunction, all those main drainage pathways that we talked about.
Mhm.
And that is really the starting point for me with my patients is, hey, this is not only going to show you a full picture, and then we can do more specialized testing based on that. You can do a urine test if mold pops up to see what mycotoxins are in there.
Mhm.
But it also saves people a lot of money. It's not going to cost like 2 grand to, do all the urinalysis and the saliva testing, the blood work, and because that does get expensive for a lot of people. And so I like to make it, as affordable for people as possible because it is, if you really want to heal, you do have to spend some money, but it's really just about, well, the long-term results you're going to get down the road are probably going to save you tens of thousands of dollars or even hundreds of
Mhm.
thousands of dollars, because we're really trying to prevent a full-blown chronic disease from happening. Like for me, if my friend hadn't come in town, I probably would have an autoimmune disease that I'd still be treating right now because I was so close to just hitting that full-blown autoimmunity. And so yeah, I'd say that. And so in terms of where to go, that's just my process. I know everyone has a different
Yeah.
one of like, well, what test do I order? Because yeah, if you're doing, urinalysis for mold toxicity or blood work to pick up on, blood sugar issues and things like that, it does get, a little pricey. But I think it's just trusting someone like you, like a naturopath, going to see a functional medicine doctor or someone who's more holistic.
Yeah,
And it's really about looking at the full health history of the person and what symptoms they're dealing with. That's really what tells us what test to order.
exactly.
And so that's the biggest thing, is like, that's why it's so important. I know everyone wants to try to figure it out on their own and like, oh, I just don't want to, go pay the money to see someone. But again, you're going to save so much time, you're going to save so much money in the long run that it's going to be worth it. And so just go find someone who can really shortcut the process for you, who
Mhm.
has, 10, 20 years of experience, that they can just,
Mhm.
listen to, 5 of your symptoms and be like, oh, I know what's going on, because they've seen this pattern thousands of times.
Sure.
And
Yeah.
so that's really what you're getting when you go to someone who really knows what they're doing, is
Mhm.
they're just shortcutting that process for you, and they're really getting to the root cause so much faster that
Mhm.
it's going to, get you results way better than if you just try to kind of navigate this stuff on your own. And, people ask me all the time, what test should I order to pick up on mold or parasites? And I'm like, okay, well, you can go get this test,
Yeah.
or, you can do the hair test and just see
Sure.
overall what's going on in your body. And then we can do
Yeah.
more specific testing if you really want to see like what kind of mycotoxin and how bad it is, or what kind of fungus and how bad it is in the gut. But again, like, there are limitations to testing, which is why you always have to do a full health history and go off symptoms with the testing. And you combine those together to come up with a really unique, tailored care plan for someone.
Sure. And back to the concept of, when we're dealing with parasites, how do you know when you're done? I mean, so there's a lot of times when people are seeing them come out and then they just keep coming out and they keep coming out and they keep coming out.
Mhm.
So in general, do you typically look at that and say, okay, maybe there's an obstacle to cure that is preventing this from completely going away, and that's why this persists? Or how do you handle that situation where it seems like there's no end to this process?
Yeah, no, I totally get that. And I have so many people who, which I think for me is funny, because I had parasites coming out for about 6 months,
Oh
before
gosh.
they
Okay.
started to taper off. It was like
Yeah.
6 months where I was like, I was half human, half worm at this point. Like, it's like, I don't know where they were living, where they were storing themselves in my body. But I have so many people who, like, they'll text me and they'll just be like, Dr. Davis, I'm still having worms come out and it's been 2 months already. Is this normal? And I just like laugh. I'm like, everyone's different. Some people
Yeah.
only see them for 2 weeks and then they're totally fine and they're gone. They never see them again. Other people, it's like, I'm working with someone right now who just after 8 months just stopped seeing them come out finally. And so it's
Mhm.
really about, putting someone on a really, individualized deep detox for, a certain period of time. And then if they still need more support because they're still seeing a bunch of parasites come out, maybe they're like 80, 90% better, but they're not at that 100%. That's when you can do, like a full moon cleanse. And obviously, again, don't go buy this, buy products and try this yourself. But
Right.
basically like 5 days out of the month where you're just doing like a little bit of a, parasite detox. And then the next month you do it. And then once you stop seeing them come out, you'll space it out to maybe every quarter, you'll
Mhm.
do one. And then every 6 months, every year, maybe every 2 years, just to kind of keep up with it.
Mhm.
But it really is dependent on the person. Like, I have so many people who maybe only see one parasite come out and then they never see them again. Other people, it's like 6, 8 months down the road and they're like, I'm still seeing these come out. This is really horrifying. But and I
Yeah,
think I
exactly.
think that's where the obsession with parasite cleansing is, because it's the
Yeah.
only infection that you visibly see when it comes out of your body. Everything
Yeah.
else is like, oh, cool, I got the virus out. It's like,
Right.
or
It's
the
not
bacteria.
satisfying.
Yeah, it's not as satisfying. But when people see like a giant, worm, and yes,
Uh,
sometimes there's liquid plaques, but you can tell if it's a worm because it's solid. Like, if it doesn't break apart when you pick it up and hold it, it's probably a worm. And so,
yeah.
like, when people, I don't know. I'm sorry if anyone here is squeamish, but
Well,
it's
then they
it's
shouldn't have
not
clicked on
this
this
cool.
this video.
But yeah, and so it's just so funny because people freak out and they're like, wait, shouldn't it be gone by now? And I'm like, listen, you guys, you're all individual people with,
Right.
unique things going on in your body.
Sure.
And it might take a little more time, and that's okay. Like, maybe I put someone on a little more parasite support on the back end of their detox. They're feeling like 80, 90% better, but we're still trying to get them to maybe be able to eat dairy more than twice a week, because they realize like, oh, once I do 3 times a week, I start to feel a little, ugh. And I'm like, okay, well, maybe we
Mhm.
need to just heal the gut a little
Back a
more.
little bit. Yeah.
And like
Right.
clean up their lifestyle and maybe
Right.
get them on, some gut healing supplements for a short period of time. But
Right.
for me, it's really about, let's rebuild the foundation. Like you talked about, like, I love that analogy of squeezing out a tube of toothpaste. That's such a good one. But really opening up drainage and getting rid of the infections and toxins, and then seeing what's left over. And that's when, diet can be really helpful, and certain supplements for a short period of time can be really helpful. And, you can use food as medicine. But if you can't digest your food and absorb the nutrients in it, food isn't going to make a difference. Like me, I was
Mhm.
on a super strict, I was eating such clean food and I was still super sick. You
Right.
know, my immune system never really came back online to get rid of all those infections that I had in my
Sure.
body
Yeah.
because I wasn't able to absorb anything. I had really bad leaky gut. My
Mhm.
gallbladder wasn't functioning, so I couldn't really digest food very well. I had really low stomach acid. You know, there were all sorts of things going on
Yeah.
that really contributed to all those symptoms that I had.
So two questions, and I'm going to say them both so I don't forget one of them. So you alluded to the idea of the full moon cleansing. This is a thing. I don't totally get why, but it seems like there is a correlation both with parasites and with Lyme disease in some
Oh,
cases,
interesting. Okay.
with the full moon. So I want to ask you about that, and if you've got any more underpinnings of why does this happen. And the other question is when you don't need when you don't know what exactly the organism is that you're dealing with, you're just going by symptoms in terms of the parasites. How do you know what herbs, what pharmaceuticals, whatever to use in order to address that?
Yeah, well, I'll answer that one first because that's an
Okay.
easy one.
Okay.
If you're just going off symptoms to treat yourself, you're probably going to miss a huge piece of the puzzle. So I always tell people like you should not be jumping on a detox until you get testing done because
Right.
otherwise you could really mess yourself up. And
Mhm.
you also have to understand too, even the testing is going to miss stuff. You know, like the stool test is not always going to pick up on
Sure.
parasite larvae, or most of the time it
Most
doesn't.
of the time
It
it
might
won't.
also,
Yeah.
yeah, and it's like it might also miss, you know, maybe some candida overgrowth or some bacterial stuff going on. And there is, I feel like everyone has this idea that like a test is 100% definitive, accurate. It's
Mhm.
not. When we learn this stuff in school, they're like, oh yeah, this one has like 60% efficacy, 80%. And you're
Mhm.
just sitting there and you're like, oh, so I really got to be a detective and figure out what the heck's going on with this patient. And so I think a lot of it comes back to seeing someone who can really help just narrow down the focus on what's going on. You know,
Mhm.
yes, you could go do a SIBO breath test and say, okay, I have SIBO. How do I treat it? Well,
Mhm.
what else is going on in your body? Do you have fungal overgrowth? Do you have leaky gut? Do you have liver dysfunction? Maybe your liver's inflamed and not, you know, producing enzymes properly and not, you know,
Yeah.
doing all the functions that it does and helping to detox your body and, you know, recycle hormones and all that, all the other functions that it has. And so it's really about just not focusing, I think, on like one test or like, you know, just focusing on symptoms and trying to fix yourself. I think
Right.
it's really important to do some sort of testing and then combining those together to really get a good result. So hopefully that answered your question.
So with that, so it sounds like you choose which therapeutics to use for a parasite, since that's the main thing we're talking about. With respect to what comes back from the hair test that you do, that
Yeah.
helps you to narrow down what the specific organism is that you're dealing with, and then you know,
Yeah.
choose.
Yeah,
Okay.
absolutely. And I also like look at people's blood work because most people have standard blood work already done. So then I look at that too to see, okay, how are your kidneys functioning? Because if your
Mhm.
kidneys are, you know, struggling, that's usually an indicator that your liver is inflamed because your kidneys are now trying to detox for you because the liver is overwhelmed with toxins. So that usually tells me a little bit about maybe a high toxicity issue
Mhm.
in someone's body. And so yeah, blood work can be a good indicator. You can see insulin resistance on there. You can see, you know, so many things, you know, kind of combining the two. And then if I need more specialized testing, you know,
Mhm.
I'll definitely order that for someone.
Gotcha.
But it's really trying to think here. What was the second part of your question? I feel like
The,
there.
the second, well, the second question was the full moon thing. So that was,
Yeah.
uh,
Okay.
yeah.
Yeah. I had another thought on that other one and then I lost it.
Okay.
But
That's okay. It's important to
uh,
look back.
But yeah, so the full moon cleansing, that's something I learned when I first started, you know,
Mhm.
doing the like learning about parasite cleansing and you know how to help people through that. Supposedly, because parasites are mostly water, they're more active during a full moon because of like the pull of that's just what people say. So it's like the whole idea of doing a parasite cleanse around the full moon is that you're going to get them when they're the most active. So
Mhm.
that's kind of the
Mhm.
idea, and I just kind of
Right.
stuck with that. I don't really
Yeah.
know the actual reasoning. I think that's the only
Sure.
reason people gave me when I first started doing it.
Yeah.
You
Right.
got people who do the full moon cleanse and they'll see a bunch of other worms come out, and I'm like,
Right.
oh, okay, there must be something to it. But I
Yeah.
think it's kind of one of those things that people are just like, you know, it might be because of that, or it could just, you know,
Some
could
other
just,
reason, or maybe it's just trendy
yeah.
or whatever,
But it's
but
really just about doing like a little bit of parasite support so that they're not on this
solstice.
crazy
Yeah.
parasite protocol, you
Mhm.
know, for a long period of time.
Right.
And yeah, back to your question, because I just remembered it.
There we go. Okay, good.
Yeah, it's like basically based on the testing that kind of tells you like, again, if you're looking at drainage organs, okay, how
Mhm.
can we safely remove parasites from someone's body without triggering a detox reaction? And so looking at the full testing of, like, well, what are the main things affecting the gut? What's the main things affecting the immune system? Do we need to downregulate the nervous system? Because that's a huge piece of the puzzle for a lot of
Yeah,
people, is they're
right,
just stuck in that fight or flight system for
right.
such a long period of time that
Mhm.
you've really got to get, that stress to go down so the immune system can even come back online, so the
Sure,
gut can
yeah,
heal.
right.
And so that's a huge piece of the puzzle. So you're really looking at all these different factors, and it's a unique plan for everyone. So I never go after systemic parasites until we go after the gut ones first.
Yeah, yeah.
So a lot of times you do have to go after parasites in the gut first, but
Right.
I'm never going to put someone on an herb that's going to go systemic and start removing them from the
Yeah,
liver or the brain or, anywhere else they could be in
sure.
the body until we heal the gut first and start
Right.
getting them going to the bathroom better. Their bloating goes down, maybe acid reflux goes away. And now I'm like, okay, now your gut is healthy enough. Now let's maybe clean out the liver a little bit. You can do some liver detoxing there, and then you can go after those systemic infections. But I think that's what's so cool about technology nowadays, is there's so many
Yeah.
companies that have designed these binders that only target certain organs, so you can detox people a lot more safely. And so
Mhm.
that's what I really like about, not just doing activated charcoal or bentonite clay, because those are a little more rudimentary and there's a lot better, products out there now. But again, it's just, looking at the full picture and just seeing, okay, like, what is going on in the body? And for me, when I see bacterial overgrowth and bacterial infections, I'm usually looking for what kind of infection or toxin is creating that overgrowth. I'm
Mhm.
not targeting the bacteria, but what I've seen in my practice is when we remove the parasites, remove the mold toxicity, the heavy metals, anything else that's popping up,
Mhm.
all of a sudden the bacteria just kind of balance out on their own. And I feel like for me, at least what I've seen in people, is the
Mhm.
bacteria overgrowth is kind of a response to something else,
Mhm.
damaging the immune system and wiping
Right.
out the good bacteria in the gut.
Right. Yeah. And I think you're alluding to the opportunistic bacteria, not the pathogenic ones
Exactly.
necessarily. So it's essentially, it sounds like identify and remove obstacles to cure,
Yeah,
and then give body the building blocks. And then a lot of times these opportunists will take care of themselves once the immune system is unburdened.
exactly.
Yeah.
Yeah, because God designed our bodies to heal. It's like we just have
Exactly.
to give it the right environment.
Right. Yeah.
And like if you look at anything in the holistic space, right? Grounding, breathing exercises, the
Yeah.
basic things that God has done in the earth to heal us is profound. Like walking through a forest, just
Hmm.
all the amazing molecules it produces in your body to help you
Right.
heal.
Right.
Sticking your feet in the earth just literally recharges your body and helps drop down inflammation, unclot your blood. It's
Hmm.
wild, just all the things that we have that are free that you can
Hmm.
start doing today to get your health back on
Sure.
track. And it's
Yeah.
just so cool just to see, like as a Christian, the more you get into medicine, the more you realize, like, wow, like God designed us perfectly. And the
Yep.
fact that we're not all, chronically sick all the time is a true miracle, because all the reactions going on in the body, how everything interconnects,
Mhm.
everything kind of stems from the gut. And there's so many organs that interact with each other.
Mhm.
Like the brain, your brain function interacts with your hormone system, with your immune system. Most of your immune system's in the gut. You have that brain gut connection. There's all these different things
Yeah.
that it's kind of wild that we're not all sick all the time.
Yeah,
That to
especially when
me,
you think
yeah.
of how toxic the world is, like how much as industrialization has happened, as all the electromagnetic frequencies have become more and more prevalent, there's always new toxins that our bodies are having to deal with. So yeah,
Yeah.
it is amazing that
Yeah.
we're as resilient as we are under those
Yeah.
circumstances. So
Yeah.
yeah, sure. What have I not asked you that you want to make sure you leave with our audience?
Ooh, that is a good question.
Mhm.
I would say another big piece of the puzzle, and obviously I know you have a lot of Christians listening, so they'll probably appreciate this one, is how your mindset really plays a role in the healing process. And I think a big thing that maybe a lot of doctors don't really talk about, or because a lot of people might get offended by it, is don't ever identify with what you've been diagnosed with. Don't ever call
Amen.
it,
Amen.
right? Don't
Yeah.
ever say my IBS, my constipation,
Yes.
my
Thank you.
bloating, because in the Bible, your words have power. Like it even says in the Bible, your words have the power to create life or create death. And
Absolutely.
so are you speaking life over your situation, or are you speaking death over it? Because that is a
Mhm.
really, really important part of the healing process that I teach my patients is,
Yeah.
hey, you've got to fix the way that you're talking about your situation, because we know, as Christians, and maybe there's some newer Christians on here who don't really know the full power of the Holy Spirit and the healing powers that God's
And
given us,
yeah,
but your words matter.
yes,
Like
they do.
everything that you say over your life, creates. And do you want to create heaven on earth, or do you want to create hell on your earth? And
Mhm.
so we really have to just be mindful of, like, I'm not trying to minimize what you're going through, but just understanding that this is just something your body's dealing with. And instead of saying my constipation, just say, oh yeah, I'm just dealing with some constipation.
Exactly.
But like,
Yeah.
I know God's going to heal. Like
Right.
he's going to find a way to heal me. I'm on
Right.
the right path. I know I'm going to find a solution.
Mhm.
Speaking life over yourself, I think is really, really important in the healing process. And there's so much neuroscience to back this up. I'm not just,
And
this
yes.
isn't just biblical. This is like,
Right.
there's so many studies
Hmm.
showing that people who speak life over themselves, who don't just take a diagnosis from a doctor, like cancer patients, and they just say, nope, I know I'm going to be healed. And those are the ones who actually heal, the ones who think that they do, because your thoughts really create physiological changes in your body. So I'd say that would probably be the last thing that I would
Yeah,
say is
that's
important.
great. That's great. It does somewhat sometimes drive me crazy, a little bit crazy when people have like the tendency to label. And I feel like this is another trend on probably on social media. Again, I'm picking all these things up third hand because I'm not really on there as much. But the idea of what diagnosis do you fit in all these various different areas, I think does have a tendency to essentially put it's almost as if this is a trait now and
Mhm.
not something that you can overcome. And if you don't believe that there's any healing that's possible, you won't find it.
Yeah.
So, yeah, that absolutely. I love it.
As a doctor, you could put someone on the best protocol, give them the
Right.
best advice, but if they don't believe they're going to heal, they never will.
Exactly. Yep.
And so that's why I work with people on their mindset. I'm like,
Right.
hey, we got to change your language a little bit and we got to understand healing is possible. And I give them all this mindset stuff to do
Right.
while they're doing the detox, while they're doing the lifestyle changes. It's really a lot of the lifestyle stuff and the free stuff you can do is really so simple and it makes the most profound changes on people.
Mhm.
I've seen people just do I'll just give them a mindset exercise to do before their detox supplements come in. I've
Mhm.
had so many women text me and just say, "Oh my God, I feel like 50% better." And we haven't even started the protocol yet.
Yeah.
And it really is, like just you said, people, I think the problem is that, people identifying what disease do you have? I think people are trying to find their identity because they don't know their
Exactly.
identity in Christ.
Ex-
It's like
Yeah.
if you know who God made you to be, like what he thinks about you.
Yeah.
The Bible says God always like thinks thoughts towards us. Like he's always,
Mhm.
and if we're listening, we can hear like, who he really made us to be.
Mhm.
So that's why I think, those times of stillness and just really sitting with God and just talking to him is
Mhm.
so important to just
Yeah.
realize, your identity is not in a disease you've been diagnosed with. It's not in whatever health issues you're going through. It's not,
Mhm.
and all this stuff that, is very worldly, that the world believes in. It's
Right.
it's, you as a person and who you made you to be. And so I think that's the biggest thing is like people are looking for identity. So
Yeah.
oftentimes we'll just find it in a diagnosis, which is really sad because those people
Mhm.
you can't help them.
Exactly. If you can't reach them, then for sure. Yeah, I love it. Where
Um,
can people go to learn more about you?
Yeah. Well, again, my name is Dr. Kate Davis.
Mhm.
And so you can find me, the best place to find me if you want, a lot of good educational info is on Instagram. So
Okay.
it's just at Dr. Kate Davis. So DrKateDavis. It'll
Mhm.
also be in the show notes.
Yep.
And so yeah, and so, I just want to, first of all, I just want to say, thank you again, Dr. Lauren, for, having me on the podcast. It's been such a pleasure. And you ask such great questions. I love when,
Good.
the conversation flows really well and it's just
Yeah.
easy and fun.
Mhm.
Because, I love talking about this stuff and I can tell you do too.
Yep, for sure.
But yeah, I would just say, for those listeners, obviously follow me on Instagram. I post daily on there about, tips and tricks you can do to just start moving the needle forward in
And
your gut.
sometimes parasite pictures.
Yeah. Exactly. If you want to see some big old parasites that have come out of my patients, definitely go check that out. But yeah, and I just want to say too, like, if you're listening to this episode and you're thinking, I can't even imagine what it would be like to go to the bathroom every single day, or, to not be bloated all the time, or to be able to actually go out to eat with my friends and not be suffering for days later on. Or, maybe you've thought to yourself, I've already tried so many things, what if nothing works? Maybe I'm too far gone. I just want to encourage you guys that healing is possible. And,
Mhm.
I've seen so many people completely heal from constipation, from IBS, from bloating, from acid reflux. And most of them were in the same boat as you. They tried supplements, they tried diet, nothing really worked.
Mhm.
And but let me tell you that, healing is absolutely possible. And so what I'm going to offer to you guys, if anyone is listening to this right now, I'm offering you guys an exclusive discount to work with me. If you're dealing with any of those gut issues that we talked about on this podcast. So if you go to my Instagram, again, it's at Dr. Kate Davis and DM me the number 100. I'm going to give you $100 off an initial consult plus a labs package. So
Uh,
You'll basically, basically what we talked about, you basically get initial consult for free, and then we'll do the labs that I was talking about, that hair scan, to see
mhm,
exactly what's going on in your body. Get a full picture of what's creating the chronic gut issues. Is it toxins? Is it infections? Is it drainage pathway issues? Um, and I'll put together an individualized detox and lifestyle care plan specifically suited to you so that
mhm.
you can finally heal and not end up in the ER in the process. And so, again, you're not stuck this way. I know it's hard. I know some of you are probably listening to this and you've been dealing with issues for decades, but just know that healing is absolutely possible. When you get to the root cause of what's creating the gut issues and you heal at a foundational level, amazing things can happen in your body. So don't ever stop looking for answers. They're definitely out there.
Yeah, awesome. Fantastic. Thank you so much, Dr. Kate. This has been a lot of fun.
Yeah, thank you.